New Beginnings in Recovery is brought to you by New Beginnings Health PC Addiction Treatment Center. If you need treatment for addiction, contact us 24 hours a day at newbeginninghealthpc.com. Picture a woman sitting in a quiet therapy room, her eyes closed as soft music plays in the background. She's not clutching a prescription bottle or white-knuckling her way through cravings. Instead, under careful guidance, she's just experienced an MDMA-assisted session that helped her confront painful memories long buried. Memories that once drove her back again and again to substance use. For her, this moment feels less like treatment and more like transformation. Today's episode asks a bold and timely question. Should psychedelic-assisted therapy using substances like psilocybin and MDMA become a standard treatment for addiction? It's a question that sits at the intersection of science, spirituality, and public policy, sparking both excitement and skepticism. Together, we will dive into a case study exploring these questions and listen to the voices as well as weigh the ethical and cultural challenges that they present. Our aim is not to provide easy answers, but to open the conversation. Could psychedelics reshape the future of recovery? Or are we venturing into uncharted territory with risks we've yet to fully understand? Join us today for this fascinating and always stimulating episode. Yeah. And we're on record now. I wanted to thank you guys for coming to another episode of Let's Talk About Addiction, New Beginnings in Recovery. And I thank the audience for joining in as well. Today, I'm joined by two of our stellar individuals I work with in the clinic. One is Mr. James Dittman, and the other is Mr. Joseph Lauper. Mr. Lauper, how are you doing?
Oh, I'm good, thanks.
All right. Seems like Mr. Dittman's having some audio difficulty. We'll give him a second. I'll see what just happened. I'm not sure. Might have been his phone, but we got a little bit of a doozy here to talk about. If Mr. Dittman doesn't join us again, we can just go back and forth a little bit, okay? Mr.
Okay.
Lauper, yeah. I don't know if you're aware, recently in the state of Massachusetts, they had a ballot question. Looks like we're getting Mr. Dittman back in now. Just see if he gets on there. But the ballot question that was the issue was whether or not psilocybin assisted medical treatment should be incorporated into the lists of available therapies, making it legal. This was a ballot question that did not pass in the state, unfortunately. And know how much you know about psilocybin, but I have a little bit here. It's a naturally occurring psychedelic compound. It's found in certain mushrooms. And in recent years, it's emerged as a promising adjunct to psychotherapy, particularly for individuals who are treatment-resistant mental health conditions and also substance use disorders. When you take it in, it's, hey, Mr. Dittman, how are you? They had a little bit of a connection. Oh, no problem. No problem. Today's topic we're going to talk about is psilocybin-assisted treatment. And we just started with the discussion. We were saying how this is a naturally occurring psychedelic treatment found in certain mushrooms. And in recent years, it's emerged as a promising adjunct to psychotherapy, particularly for treatment-resistant mental health conditions and substance use disorders. There's some studies that showed that it can be useful for treating addiction, alcohol use disorder, and also depression and PTSD. And the key thing was recently, it was on the ballot in the state of Massachusetts, so they're trying to legalize it, and it did not pass, but it wasn't a blowout. So it was almost close to 50%. There's a possibility we might see this on a ballot again. and a lot of people are looking to it not only on the local level, but also on the national level. There are some concerns that are raised by it. There's some risks that there are potential side effects, which includes psychological distress. Some people get what I would call quote unquote challenging trips with it, the mushrooms, and there can also be a triggering of psychosis. So while it's being looked at, it's something that shows promise, but has not been fully accepted. Any thoughts on this, you guys? Just
I
so based
love
on what I
this.
said.
I love this subject. Very interesting and very promising. Um,
Okay.
like the trip depends on how your mindset is, and it can be very controlled. I think. I don't think it's uncontrollable. A lot of people think it is. Uh, and
Yeah.
it can literally rewire your, the way your brain works. You said,
Yep.
addiction, trauma, anything. It's got a lot of promise with it.
Okay.
I don't know enough to
Okay.
really get too in
No, no, that's no, that your comments were very helpful. I think because for a lot of people, they don't know a lot about it. But I can tell you, even at the highest levels of government, there are people in high positions in government who are advocating for this as a therapy. So it's something that I don't think is going away in terms of a potential treatment. Mr. Lauper, did you want to comment on just the little intro part there, and then we're going to just discuss a hypothetical clinical case.
Oh, yeah. Well, I mean, back in the day, I took it a bunch of times, and this was before I had become like dependent on anything. And,
Mhm.
it was really compared to some of the other chemicals that I had messed around with, the
Mhm.
psilocybin was pretty tame, but it was still
I
very
see.
it really changed a lot of the way you like, it'll make you think about things in a different way just even after one one experience, and, I do
it's
know
true.
they were saying some people have adverse effects, and I've seen it, like, just certain people are not meant for it, and usually the good thing is it's pretty usually obvious, like, the the people
Mhm.
who shouldn't be taking it, it's fairly obvious, at least for the folks that I knew that ended up, they really messed themselves up. I think we all agreed they probably shouldn't have done it anyways, so
And what were the issues ahead of time? Was it a personality issue that you noticed or prior
If
usage patterns there?
mentally vulnerable in any way,
yeah,
you could have a strong,
my friend was a
you could have a
little
strong
off
mind,
to begin with.
Okay.
He had,
and
So
issues, he was like, I would call it more borderline, like, autism, maybe Asperger's. He had,
okay, okay,
focus issues, and after he started messing around with that stuff, it was like he never came back. Like, he was always a little bit worse for wear.
I see, I see.
really, that's a,
And is was that what you were getting at also, Mr. Getman, in terms of,
um, not. I mean, his is a little different than mine. I was going to talk about my experience with it, and the different forms that it comes in.
Mhm.
Comes in chocolates, you know,
Right.
all different kinds of forms of getting it. Honestly, after my experience with mushrooms, I've never seen the world
Mhm.
the same. It just opened my eyes to a lot more than, what you can see. It definitely
I see.
widens your vision, I think, when
Is
it
that
comes
in
to
a good way or a bad way?
in a good
Or
way, in a good
it doesn't matter, so
in a
In a good
very
way?
good way,
Okay, okay.
definitely. And not even in like a
So,
not in like an immature way either, you know?
no, I understand. You know, in certain areas, like for hold on one second, guys. We got another caller calling in. Former student of mine who's a medical student. Hey, Miss Duncan, how you doing? All right, we started up an episode of the podcast. I wanted to invite you in, if you'd like to. If not, it's okay. We can get you another time. But it's just we run this podcast on Sundays, and today we're talking about we have two of individuals I work with who are really good in terms of we're just getting into the discussion here, but psilocybin use, and we're going to discuss a hypothetical case of this. In Massachusetts, there recently was some legislation to try to support putting this on the docket as a law. It didn't pass, but I suspect because there's interest both on the state and the federal level, and this is a potential treatment that it'll be something that's going to come up. So we're just initiating the discussion. If you can't make it this week, it's okay. I will give you a call again to work through, but every week the topic changes. So, okay. All right. Um, you're welcome to listen in. I can send you a link if you want. If not, you got to go. It's okay. We'll catch up again. Either way. Oh, okay. I'll send it to you now then, and you just have to click on and you'll join. I've already told them about you. For my group here, Miss Mr. Duncan is he's a third year medical student at Meharry Medical School. And he has an interest in addiction as well as he's doing his family medicine work right now, and so a fantastic gentleman. Known him for a couple of years, so I'm going to send him a link and we'll see if we can connect him in while we continue the discussion. Okay. I'm going to send you the link right now, okay? Thank you for calling. Yep, yep. Bye. So, I just wanted while we're waiting to see if Mr. Duncan gets in, I just wanted to quickly reiterate, and I'm also keeping track of time because I know I don't want to keep everybody here. But it seems like from what you guys said, um, both of you have had some experience with it. You didn't really have any negatives about it, but you did say it's something that needs to be carefully monitored, and certain people probably should not get involved in its usage because of the potential negative sequelae, if you will, of what can happen if certain types, and it was more personality types. Would that be a correct assessment of what you were saying? Okay, okay, and that's fair. That makes sense. And to get to what you were saying, Mr. Dittman, about how it can widen people's understandings of things. Um, I I can tell you, like in certain areas, like for example, um, marijuana is one of these things that people often use. They say it enhances creativity. This is something that shows up a lot in reggae music. I'm Jamaican, so I hear a lot of these things, but this is something else that shows up, and a lot of people don't know this. Like Louis Armstrong, I believe, he used to actually have it written into contracts that they would supply this when he performed. It helped and enhances his improvisation and a whole bunch of other things. So there is precedent for people using certain types of controlled substances to enhance creativity. So that's not that far off in terms of what they see. So very interesting discussions, and as you know, on this topic, we like to really try to talk about things that might happen also in real life situations. So I wanted to present to you guys a case. This is a theoretical case now, and the names are not, protect. They're not the names of the individual. So there's no. These are all theoreticals, but they're based on real world events. So I wanted to discuss with you an individual. Her name is Maya, and she's a 34-year-old marketing executive. She has a past history, currently not using anything of alcohol use disorder, which was severe. And she also, not She stopped like 10 years ago, so at age 24. She also has a history of trauma from childhood abuse. That was another issue. And she'd been in inpatient rehab facilities before, and she'd had some problems with that. And I think we're being joined by our student Duncan right now. He's going to come on. So she has worked very hard to do very well, and she'd been in outpatient therapy recently and had some difficulty. Her triggers, if you want to say that, are primarily when she gets into high stress situations. She's an overachiever. Things got a little difficult with her past struggles, but she's worked very hard. And now she's worked her way up to be an executive in a marketing agency. So she's very happy with that. And she was doing well, but then started to have some difficulty as they advanced her. She started showing up to work late on occasions and had some absences, which were last minute call outs. And essentially, the HR department got involved and they pulled her aside and say, hey, she'd been upfront with them before about her past. So they said, we're a little concerned that things are going a little tough with you now. And we want to make sure that you start, trying to address this. Otherwise, it potentially has the risk for creating problems. So you guys, let you digest that part there. I just wanted to introduce two other guests who've come on. We have our clinical nurse, Marceline Pierre. Hey, Marceline, how are you? As you're checking in. And also Justin Duncan, our medical student. Mr. Duncan, if you can hear me, you can unmute yourself and just say hello to the audience. If you're still getting on, then that's okay. Um, and for everyone, I just want to repeat the case again. We've got a case of a 34-year-old woman, marketing executive, prior history of alcohol use disorder, also trauma from childhood abuse, and she'd been in treatment programs before, did very well for several years, and now, as mentioned, she's a marketing executive and moving up in the company. However, the stress of her responsibilities and her concerns about her past have led to a situation where it came to the attention of the folks in HR. She was missing a lot of work-related duties and sort of call-outs. So based on her history, which she'd been honest and upfront with them about before, they recommended that she pursue possible therapy. So that's where we stopped. And she decided, because she'd heard about psilocybin, and that she'd had multiple prior inpatient rehab attempts. She decided to investigate a pilot program where they were offering this as therapy for treatment-resistant addiction. She was intrigued, but hesitant, and she had a long-term therapist, Dr. Ruiz, who explained to her that early results were quite promising, especially for patients who came from trauma backgrounds. So the question I had for my guests, should this therapy be offered as an option for her? She's someone who's failed multiple treatment attempts before and is now in a very a worsening situation at her job. Um, do you think that, Mr. Lauper, Mr. Dittman, I'll give you the first crack at this because you guys mentioned that this type of therapy might not be the best for everybody for certain type of personality types. Do you think that she fits that personality type? What would you recommend in this case if she were a friend and coming to you? Again, this is not her per se, it's her psychiatrist. Her therapist has recommended that she consider it. It's a new pilot program, so it's sort of off label because I told you in our state, at least, it's not legal to prescribe it, but there are some sites that are participating in off label usage. Anyone like to take a stab at that?
Well, with her background, excuse me for my voice too, it's all forced today. But her background with the
Oh, no,
trauma,
you're good. You're good.
it sounded like, uh, you know, her being late to work and all that was stemming from her trauma, not from her past addiction or whichever.
Yep.
But with her background, I would ease her into it, maybe microdose her at first and then
Okay.
work her way up a little more with the dose. Because for
Okay.
somebody like her, it could be, kind of freaky just jumping into like a full trip. I think what they should do is
Okay.
microdose
Do
her
you,
and try to work out her
okay.
trauma.
Okay. So you think then it should be offered, like her background, because her therapist did say that it seems like it works for folks, but any concerns about her known background that would make you say, nope, I wouldn't do that, or I would consider something else.
Yeah,
It
I
should
kind of
probably
feel
be
that
fine.
because no, she probably would definitely be fine, but I'd definitely be
Okay.
careful.
Well,
Yeah.
I'm just saying on based on her, if it's a therapist who is dealing with her regularly offering it, I mean, based on that alone, I would assume that
Yeah,
they would be, you know, more familiar with her or have her best interests in
yeah,
mind.
that makes sense.
Okay.
Absolutely.
Okay. What about you, Marcel? What do you think?
Um, don't know if I fully get the full idea of the treatment we're referring to, but I do know that
Hmm.
there could be some type of the fact that she's dealing with
Not
recent
sure what's
trauma.
going on here,
It
guys.
could trigger a
Froze
lot
up a
of
little bit.
different type of because trauma and addiction has something in common. Because a lot of people that has a past story in addiction due to that addiction
Hmm.
sometimes um, find themselves in a situation where they get abused and then becoming a sense of trauma in their life. And this novel trauma, in addition to what's in her memories from the past could, you know, reach each other and create situation where that can trigger other behaviors where even she's missing work. There is some kind of similarity between now and then. So it's possible that the therapy will work for her, but we do have to considering, her past and this new trauma going on. Which it's like some type of PTSD that coming back to you. The fact that she has
Okay.
something new that just happened.
Okay.
But I'm
And
not
Marcin,
sure
check your
exactly if you can rewind a little bit of what type of treatment are we saying the therapist we were trying to refer
okay.
to?
So we covered this in the initial part. I'm sorry, I'll just go. It's psilocybin therapy, mushrooms,
Oh, okay.
mushroom therapy, and it's a relatively new thing that's being considered, and this is sort of off label, and she hasn't accepted this yet. This is something her therapist had recommended. Also, Martin, check your connection just to make sure you're sort of going in and out. I don't know if you're a little bit far away from the mic or whatever, but it was going a little in and out. So this was something that was recommended, and she was inquiring about treatments because she was anticipating that she might be having some problems at work because the stress is triggering her and she's having some difficulty. Um, Mr. Duncan, how are you? Are you available? Or here?
Hey, I'm here. I'm kind of out the house at the moment, but I
Oh,
can
no problem. We like it real. That's the thing. We keep it so no matter where, as long as it's not in the toilet and you don't flush, then I think we're okay. So, anything to contribute to the discussion there? You heard this is mushroom therapy being suggested by a therapist for this young woman who's very, high influence in terms of her job, doing well there, but starting to have some difficulty because of the stress associated with this. So she was looking at this as an option.
I think there would be a few things to consider, like her condition previously. What is she predisposed to? Like, is this something that could, you know, be a slippery slope to something that makes her worse? or is it something to make it better? Is it, something that can cause a new addiction? And maybe we can get weigh-ins from, kind of how it's helped others in the past. Is
Right.
it something that's worked well? Is it something that, needs to be monitored closely, or more people at risk of more adverse effects? But
Well, I can
yeah.
tell you, she's had a history of alcohol use disorder for 10 years. She also had history of trauma from childhood abuse, which she's been in therapy for and still is. And she also has gone to rehab 3 times. And she failed these in the past. But each time, if you talk to her, she said she's had some growth from them. So it wasn't something that was not worthwhile. In the end, though, what ended up happening is she was able about 6 years ago to really pull out of this and do very well. And she now works at this marketing firm and she's moving up the ranks, was doing well. But she found, and this has been an issue before, um, with the increased responsibilities, she's started having some problems, which had led to her having sort of absences and lateness at work, which got to the point where it's prompted the HR people to sort of talk to her. So they know about her struggles. They don't know that she's planning to do this. So I thank you guys. Excellent input. I just wanted to. So she agrees to participate. Initially, she told her therapist that this was something that she was not interested in doing, and then she decides to participate because of the pressures at her job, mainly the repeated absences and the late call-ins. She doesn't go into much, right? Because she doesn't have to because of HIPAA laws. She just says that she's in some form of treatment and she wants to continue it um, without giving too much information. So the question I have for you guys are, first of all, do you agree that she should go into the therapy? Or remember, she initially did not want to do this, but because she's concerned now that she might lose her job, she's more willing to participate. The other thing is, should she be allowed to consent to the therapy and do this mainly because she's getting pressure from her employers? Do you think that that should sort of be forced upon her in that way? Or so is she actually consenting to this or is she being coerced? That's the question I have. Yes.
Kind of on the fence about it because her mishaps at work are all pointing towards like
I don't think she
a
should do
mental
it because she's being
vulnerability.
pressured by her job. Because
All right.
that wouldn't
Let's
be
actually,
that
we're gonna
wouldn't be
do
that
Marshall,
wouldn't be voluntarily.
we're gonna do one at a time. We'll let Mr. Dittman talk
But
and then we'll get you. Yeah, Mr. Dittman was just speaking. So
I don't
that's
hear him
okay.
talking. I can hear
That's all
you
right.
though.
Uh,
No
all right.
problem.
No,
It's all right.
Mr. Dittman, you're talking? Okay.
yeah. Go ahead again, Mr. Dittman.
I was saying that I don't know if she's mentally, strong yet. It does sound like her work is kind of pushing her into it. Kind of what it would do, I think, is take down all of her mental shielding from her trauma and kind of
Mm-hmm.
throw her right in the middle of it to kind of deal with it with her therapist, which is good, to kind of stop suppressing whatever it is that's truly bothering her and really crack it open. Uh,
Okay.
but could turn into a
Okay.
bad trip.
Okay. All right. Marcelin, thank you, Mr. Dittman. Marcelin, did you want to say something?
No, I'm not able to hear Mr. Dittman. I can hear you and Joe.
Oh, okay. Well,
Uh,
if you heard me, I just wanted to know, did you have a response to the questions I asked earlier?
Yeah, no, I was gonna say I think she shouldn't do it because she's being pressured by her coworkers or the job because
Okay.
that wouldn't be fair, And at
Mhm.
the same time, too, I feel like trying the therapy would be a good option because if it's been proved that that works sometimes for anxiety and stuff like that, and, in that moment she's dealing with an episode, so
Okay.
it's like I don't see the deficit of trying it. We'll
Okay.
just say that for work and
Okay.
Now I don't know
Mr.
what the
Duncan,
research
Mr.
said
Lawford?
about.
Kind of
Hmm.
agree.
Like
Okay.
Mr. Dickman was talking about, if that will develop another addiction, that I will have to know find out about the research about that first.
Okay. So you want to look at addiction risk possibility. Um, there we are weighing the fact also that this is a new therapy. And in the earlier discussion, it was brought up that there's certain profiles of patients that might be at risk for it. So given her trauma
There you go.
history and the multiple relapse, maybe.
Uh,
But on the other hand, it seems like she's shown that she's responsive. Yep. Mr. Lauper, did you want to say something?
um, I had something to say and now
Yeah, that's okay.
I just know
We
it's,
keep it real here, so it's all
I'm
right.
just running
If
around.
you wanna think about it, no, if you wanna think about it, that's okay. Mr. Duncan, how about you? Any other points in there or
Yeah, I would just say that, because she denied it previously and now she's getting that pressure from her job, I would say no slash move with, extreme caution, erring on
yeah,
the side of no, more because, before when she was clearly thinking, she said no, but now there's additional pressure. She's saying yes. So
okay,
personally, I wouldn't.
okay. So I think very good responses in a complex situation. And does anybody disagree with the fact that she didn't go into details on what sort of therapy she's obtaining? Remember, this is something that's not, at least in our state, it's not legal per se, but she is undergoing this as part of this pilot, but she has not allowed her employers to know that. They just know that she's seeking this treatment, a treatment. Anybody have problems with the fact that she didn't disclose that to her employer? Um, well, I'm gonna let you guys think about that. Well, just to keep moving on, I'm gonna ask the next question here. So she starts the treatment again under whether or not just or unjust pressure, and she does very well. She feels that things are going well for her. Her focus is improving, and as Mr. Dittman had pointed out earlier, she has an expansion in clarity associated with the treatment. And overall, she feels she's doing well. And no real issues come out of it. Um, her employers seem to be very happy with her progress, and after about 5 to 6 weeks into it, they consider her again for, advancement in the company. They're happy with the way that she has, improved, and whatever she's doing, they say that they're in support of her therapy. Um, one day while she's, going to the session at the clinic, there's a gentleman there who's unfortunately, he's a news reporter, and he happens to tell some folks at his newspaper about the therapy that he's undergoing. And while they're not supposed to, somebody goes there and reports on the activities in the clinic in this pilot study, and they sort of just show up. And while the staff there is trying to get rid of them, one of them comes up to our patient Maya and asks her what she thinks about her treatment there. She denies to speak. She says she doesn't feel comfortable talking to the media, but unfortunately, they run the story, and somebody from her job notices that she's at this clinic and has been going to this clinic, which they then report to her boss, who then reports this to HR. Now, again, to redress the facts, this is information. She's protected by HIPAA laws, and you guys can talk about that if you want. She did not consent to the interview that was performed. They sort of caught her coming out of her session, and then this somehow got back. And it wasn't like, you know, newsflash. It was sort of like on social media, that sort of thing, that she was a participant in this clinic, which has now worked its way up to her boss and the folks in HR. And their main concern is that this is a therapy that has not been approved by the state for treatment. So it's not a legal therapy. And unfortunately, they don't seem interested in the details on what this pilot study means. So, what do you guys think about that? And just to make it a little bit, they're telling her that they're concerned about the way this makes the company look, that they would have people in employment who are actively using mushrooms while they're on the job.
Yeah, it
Hey,
sounds like they're
Andrea,
all just a little.
what was that, Mr. Denman? Can you say that again?
It sounds like she might be a little self-conscious, and the company might just be a little embarrassed and trying to, I don't know, dissociate themselves from it.
Okay,
But either way, it's got good results. So I don't see any harm in it.
okay. Um, so now what about the pressures from her job? Do you think that do they have the right? Again, remember, they were the ones who pressured her to get the treatment, and
Yeah, exactly.
and at least how do people feel about that? Do you think that she should be pushed? I'm not really sure what they're asking her to do at this point. But do you think the concern is that the treatment is a problem, or that the way it makes them look that they have an employee who's on this treatment is a problem, or both?
I think that they're just worried about how they look at this point.
Yeah. All right. Anybody else?
Yeah, I agree. They're probably just trying to make it less optically bad.
Okay. Do you think it's within their right, and should they push her out?
That I'm not sure about. Sure.
Okay.
I would say not.
They should be
Um,
backing her up.
but then again, I mean, they do worse to people for less. So thank you.
Okay. Anyone else? Anyone else? Should they
Well,
even know? Is it any of their business? Should they have used that information, whatever way they obtained it? Is it a violation of her protected medical information that should they be using this as a means or a tool to um, strip her of her employment there?
no.
No, absolutely not.
Okay.
I think she's
All
protected
right.
by so many different laws that if we if we start looking around in
Hmm.
terms of law, she's been, they violated a HIPAA there already. Even the social media that, whoever posts that could get in trouble for just doing that. And her job would be, we'd have to deal with more issue than just firing her if she get a lawyer or something like that. And you know what I mean? So there's so many different laws she's been, so
Okay.
I
I,
think
I agree.
they will be, they should not, push her out of her job due to that because it won't stop
Yeah.
right there. The big won't
Look,
come in from this if she decide to share with this.
very good points. And the one thing I will add to the background is that she's an outstanding employee. So just to move the description along, what actually happened is that they're under pressure now. Some folks want to get rid of her because of the optics, as you had mentioned earlier, Mr. Lauper, Mr. Dittman. However, the higher ups realize how valuable she is to the company, and one of their main competitors actually has reached out to her and told her that she's welcome there. They'll actually increase her salary if she comes and joins for them, and they're glad that she's undergoing the treatment. In addition, Marcel, as you said, she starts to get unsolicited calls from lawyers who are aware. I don't know how they got aware of the situation, but that they would back her up in a lawsuit against her company. So there are these issues that are going on, and at least the company decides not to fire her because she's a valuable asset, and they want to see how this pulls out. But she actually decides on her own that she's going to leave because she feels that this should never have been disclosed. So she leaves, goes to the competitor company, and does incredibly well there. while she continues her treatment and doesn't pursue any litigation against her former employer, but really starts to become somebody who's doing well with this type of therapy. To wrap it up, there are two things that happen. Um, the first is that she gets a visit from her mother. Now, her mother's a deeply religious woman, um, isn't really necessarily, but she has strong convictions about a lot of things, and she's horrified that she's on this, what she calls a hallucinogenic treatment. But she doesn't blame her daughter, she blames the psychiatrist. And she says that she has religious objections to this type of therapy. It shouldn't have been offered to her, even though she was an adult and accepted. And of course, her mother's not aware of the pressures from the job at that time that they were looking to fire her if she didn't do something. Is the mother wrong? Should her therapist have been more cognizant of potential cultural conflicts with the family? And should that have been factored into the decision to treat her? Or is it that she's an adult and she makes her own decisions? Um, Mr.
I
Duncan,
think
we
her
didn't.
just making.
Oh, go ahead. Go ahead, Mr. Dittman.
I think her mother's just making unnecessary like worries
Yeah.
for her about this situation. You know what I mean? Because if she overcame a lot of this and the treatment's working, you know, why should she have anything bad to say about it? It'd be causing like another issue kind of for her.
Yeah, I agree
I,
with that.
that's excellent point. Excellent point.
I
Um,
think it's always since the platform is open, yeah. I mean, it's
yeah.
necessary for the therapist to always check what we call culture, family values, because we are dealing with, especially in the United States, so we all different in some background, culture, and values. But it usually have to deal directly with the client, not with a family member. So if the client
Hmm.
didn't mention anything in the initial interview when she was doing the admission, I don't think the therapist did anything wrong because
Sure.
that will have to do with just the client directly to make sure she get what kind of culture she's dealing with starting the session or the
Okay.
treatment. But as
Mm,
far for the mother, that's that doesn't really. It's to me, it's not so much of a concern. I don't think the therapist did anything wrong by not checking with the mother.
yeah.
She's
All
a
right.
grown woman.
Yep. Yep. All good points. Mr. Duncan, did you want to say anything on that?
Yeah, just that I agree that, this should be independent of both the job and the mother. She's doing great at the job. This is, she's not unable to make her own medical decisions and things like that. So there shouldn't be really any consultation with the mother. So that's what I believe. She's doing well. And, I feel like there should be no
Yeah.
interference there.
All right. Just quick points, and we're gonna finish up here. Uh, she decides now her life's really doing really well. She buys a home. She has a new boyfriend, and she's thinking about he's gonna propose, and so she applies for life insurance. She's 34 at this time and wants to insure. And in there's a question about treatment. She discloses that she's on an experimental drug treatment, and she tells them it's psilocybin therapy. Um, Unfortunately, she gets denied coverage. They say due to high psychological risk, given her risk profile. So the question I have for you is: should experimental therapy impact insurance eligibility, and what protections should be in place for people who pursue, as she did, innovative but still stigmatized treatments? And with that in mind, even some of the accepted ones like buprenorphine and methadone, they still have a stigma attached to them. So what do you guys think about that?
Well, it's a treatment for good health, so I don't think the insurance should um, you know give her trouble about that. If it's a therapy, if it's a treatment, it should just go along with good health and the whole insurance thing, in my opinion.
Yeah. Excellent. So again, they're arguing that this is something that's still experimental, and not in this case, but I did a case like this with somebody who had a gene disorder which had a hypothetical risk of causing pancreatitis, and we randomly called insurance companies, and believe it or not, they wanted to raise the premiums 3 to 10 times for a theoretical risk. So it was just something to keep in mind, but this
I
is
do
working
understand
again.
what they are
Yeah,
kind of saying too.
right. All right. Anyone else?
I think
I mean, this is
in
working
term
again,
of
right?
life insurance, it's this this business is very like different from others that we're dealing with on a daily basis. Usually, they focus a lot on your health, what's in your
Mhm.
medical record, and what are you doing, and anything that can cause any type of
Injury.
any type of side effect.
No, yeah,
They
demise.
want to know how long you smoke. Have you been smoking for 30 years?
Yeah.
Anything. Even if you like, so anything like that, they usually use it and have
Mhm.
their own way of see if you approve or not.
Mhm.
I won't be surprised that the insurance company go for that. So it's definitely something that I will not hold against them
Okay.
because that's how this
Yeah,
business works.
Mhm.
I agree.
They study your life to see if you qualify. If sometimes they give you lower benefit, like it's depending on how well you're doing. Like if you have hypertension and diabetes, anxiety going on, if they ask you all this question even about do you ever use alcohol or drugs, whatever's going on in your life. So I don't know. It's kind of funny. Sometimes when I hear commercial, they say they're not even gonna check anything. I'm like, even is that even real? You
No.
know?
That's
So,
something.
I do
I
see what
think,
they're saying though.
yeah, they need to see if you're alive, right? That's
all
no,
right, they
that
might think that mushroom could cause any type of, some kind of, unexpected blood clot if they don't have if they have all the research about it and it's FDA approved, that's something else. Especially it's not FDA approved, they don't know much about it, so they don't want any surprise. They have to pay all your money, so
So,
therefore, it could be like,
and you really,
I'm not, so
well,
I'm not gonna have any grudge against them for that, I guess.
well, you and Mr. Dittman raised a good point, though, and I want to ask our panel: are they putting her into a catch-22 situation? How are you going to get the data to determine if the drug works if you don't have patients use it, right? But if the patient is using it, it seems like they're penalized because they can't get insurance. So I guess is she just a victim of coming into this too early, even though her data is going to be used eventually to determine that this might be safe in patients like her in the future? Should she be penalized for that?
Seems like it.
Yeah.
It seems like just one of those sticky situations where she's just so fresh and new into it that the insurance companies are still going to be like, well, your mind is going to be well, altered by this. So, like I can see what they're saying about that because,
Mhm.
you know, they they don't know if she's going to put herself in a harmful situation or whatever, and they don't know much about it either.
Mhm.
And like Mr. Pierre was saying, they'll look for any reason to not pay you. So
That's true.
um,
Excellent.
it is just one of those situations where it's just too soon
Yeah.
to
Yeah.
know.
Okay. Okay. Hold that thought. It's a great point there. And I just wanna we're gonna finish up. Mr. Lauper, Mr. Duncan, you guys have any comments on this last part?
No, I kind of agree with all the statement.
Okay. Gotcha. Mhm, mhm. Okay. Okay. Alright, thank you. Mr. Duncan, I'm sorry, you said you agreed with what the guests, the other panelists had said so far, or do you wanna add anything else, or
Yeah, as I was saying, I was agreed. This insurance situations is sticky. I know. I guess there's rules behind it for, you don't want to cover treatments and give treatments to patients that haven't been, evaluated by the FDA and aren't, standardized treatments. But there's always situations where off-label drugs help people all the time. So it's just one of those weird situations, and it just comes down to the physician's judgment.
okay. Alright, I wanna thank you. We're gonna wrap up with this, I'm not let you guys go without one last thought-provoking question. So she has done very well. She rises in her categories at the marketing team, and she actually remains sober, volunteers at the treatment center, and shares her story in recovery meetings. So becomes really an advocate for this. And her case is cited in a policy brief to legalize psychedelic therapy for addiction. And this makes it all the way up to the national government, as I mentioned. But there's another lawmaker there that argues that her recovery could have been due just to regular therapy and support, not the drug. So I want to ask you guys this as we wrap up here. Should individual cases like hers, Maya's case, influence national policy? What kind of evidence, clinical trials, lived experience, economic data should be prioritized in making psychedelic-assisted therapy standard? Remember, in the state of Massachusetts, where we're at, this actually almost passed. And if there was somebody like her, if you were in the voting booth and you saw a little commercial documenting someone like her, this meteoric rise in this company, she's done incredibly well on this therapy, and it helped her when she was starting to get triggered potentially into another relapse. Would that influence your decision to support a national policy drive for this or a state policy drive? What would you like to see in terms of evidence, or have you seen enough? Some folks, like you said, you guys had mentioned you had experience with it before, so the floor is open. And we'll close with that. That's my last question. I didn't have anything else.
Well, it sounds like she was already in therapy way before uh, the mushroom test,
Hmm.
and she got good results only after doing the mushroom. So, um, the accusation that they had nothing to do with it and it was just therapy just doesn't make sense.
Okay. Okay. Excellent. Did the therapist win here? You think by sticking out?
I do think the therapist won.
Okay.
I
Okay.
I think this was a victory.
think
Hmm.
it's very, yeah,
Okay.
it's a very tricky one. This last one. Usually, you need in order to sign something where everybody's gonna use, you need a lot more data than just one case.
Okay.
Because we're talking about, the whole country might start using this, and if we're not sure about the data, she was in therapy, the mushroom worked for her, doesn't mean it's gonna work for everybody. And with all this data missing, not enough clinical trial for me to pass this as a federal level or as a legislation. For me, that's my opinion. So I kind of agree with this, politic man for thinking that way,
Okay. Okay.
because sometimes it's just one unique case.
All right. What about some of our panelists have said they've actually used mushrooms in the past. they found that it was very helpful and controllable. And they said initially that individuals who have certain personality types, ones that might be struggling with addiction on a level that this might not be a good intervention for them, they should probably avoid it. If maybe if there's a large number of individuals who have tried it, not in a formal method because it hasn't been, standardized or legalized nationally, but enough should individuals like that be encouraged to talk about their usage patterns to help push the conversation along. If somebody had a bad time with it, they should let them know, or does it still need to have standardized, rigorous trials? I'll draw this comparison with smoking. For a long time, there were no bans on smoking use, even though we could see sort of theoretically what smoking potentially did. And if you go back to the 50s or 60s in the United States, there were a lot of physicians who were smoking. You would see them. Even when I was in medical school in the 80s, one of the doctors I work with, he chain smoked. And we went outside. The culture has definitely changed there, but again, not exactly the same thing. But what do you guys think in that regard?
I mean, I have experienced, a bad trip,
Hmm.
and I've experienced the good side of it. And it was all on mindset.
Right.
When I had my bad experience, I was sitting in like a dark room listening to Rob Zombie. I kind of put myself in that uh,
That's
situation.
okay. Yep.
Man.
Understood. Understood.
But it is a little different from smoking. What I noticed about it is it kind of forces you your head, and it's hard to explain. It's very hard to explain. Um, but I can see why it would help with, trauma and addiction.
Okay. Okay. Excellent points, man.
So
Excellent points. Guys, we're gonna close now, but I just want to ask you, after this discussion, just, I'm not, we're not, this is not a legal thing, right? Sure. But I'm gonna ask you, just would you recommend it now based on what you've seen here? If this were a real case, or would you say, nope, needs more study? We'll start with you, Mr. Dittman.
I'd rec- I'd recommend it.
Okay.
I mean, the worst that could happen is that you have, you know, a bad time,
Mhm.
and people have those every day.
Okay. All right.
You know?
Yep. All right. And you see potential for it as a treatment because it does have benefits, which is why the patient got treated in the first place. Okay. How about you, Mr. Lauper? You recommend it or uh, not ready for prime time? Okay. Yep. All right. Wow. Okay. Good. Okay. So okay. And as you're speaking, and both you and Mr. Dittman have articulated these points very well. There might be a room for like focus groups people who've had experience can help direct. Because it seems like what you said is backed up in the literature, but there are certain patient types who are at increased risk, and at least with some experience, you might help people identify what it might be like and things they need to look out for. Um,
I would like to add
yeah.
one little thing. The bad trip I did have,
Mhm.
it wasn't traumatizing,
Okay.
let's say.
Mhm.
Yeah, I mean, wasn't such a bad experience that left me scarred.
Mhm.
If anything, it was just, you know, being in a weird mood or uh, having a weird dream, but you wake up from it and it doesn't leave you scarred in any way. Yeah.
I understand. Excellent. Thank you for sharing that. That's understand. Excellent. And Marcin and Miss Jackie, we're gonna end up with you guys. What do you think? For it, against it? Need more information.
Yeah. I think for me it would have been use it at your own risk
Yep.
because another to go prime time I might need more because of especially it's you use it for anxiety and all that. I don't know if it sometimes there is this medication that can cause like some mood swing, anger. You can use something for something and it creates something else, and there's not enough study that's been done. Eh, You even hear commercials, some medication that no cause suicidal thought, you know?
Yeah.
So
Yeah.
I will need more data, but
Yeah.
I would say use it as your own at your own risk, I would say.
Okay.
That's a good
Yeah.
point. That's a very good point.
Yeah. Safety first. All right. And now, Mr. Duncan, we'll finish up with you.
I would say I would also need more data, but if it does help her, then that's great, but it's not, I guess the adverse effects could be bad, not as bad depending how it affects her, but I'll just need more data.
Okay. All right. I want to thank you each for coming on today, and I want to thank our listening audience for listening. This, as you can see, is a complex topic, and because it's working its way up at both the state and federal level, I'm sure it's something that we're going to see the future. I hope also, as we went through this case, the complexities of how to make these decisions and where certain external forces can have a part in how these things are made, such as employers, insurance companies, even family members. Um, at New Beginning Health PC, again, we want to bring these issues forward and demonstrate that the management and understanding about addiction is something that's shared by us all. And as you can see here from here today, from individual patients, faculty, and into people who are entering into the field, the perspectives are broad, but overall the contributions are rich, and we're all very much more educated now on the nuances and the hard and to some extent simple decisions that need to go into policy and implementation of management strategies in dealing with this and other problems as related to addiction. I want to thank our panelists for coming on today for an outstanding job once again. And for those who are listening, I'll ask you to come in again next week when we post another edition. Thank you. Everybody have a wonderful day. Thanks. All right. Thank
Thank
you,
you,
guys.
Bob.
Thank you
Thanks,
for your
guys.
time. All right. Yep.
See you
Take
later,
care,
guys.
everybody.
Bye.
Thank you.
Bye-bye. Thanks. Bye.
Not sure what to do with Dr. Brown.
Oh, no. The only thing you have to do is just complete. It's going to ask you, Mr. Lauper, also to complete the upload. You just have to sign on to the app till you see it says upload complete. And then I can process the editing for longer term. But then, other than that, I'm going to leave the studio now, and then it'll say, all right, you'll see it when you go to the link. All right. Thank you, guys.
Okay.
Thank you.
You're welcome.